outside. The outside has been a little less than nice to us this year. We've gotten through some pretty intense tree allergies and cottonwood. I'm sure everyone in Western New York knows about cottonwood, those little white fuzzies. We got hammered with those this year. My goodness. Um, Thank you, Mark, for going through all of those. Um, Maintenance. A little bit about me. I went to college in South Carolina, moved up here about 15 years ago, and did my training down there. I will tell you that allergies and drippy noses is, whoa, such a big problem almost year round down there. So we're kind of spared some of the seasonal stuff up in this way. I was a chemistry and music, and then I do all kinds of ENT stuff, but definitely have some roots in South Carolina before I moved up here. This is sort of just an overall agenda. We'll kind of go through some of the basics and some anatomy, some of the sort of basic science, like what's going on in my body from a standpoint of medical functional standpoint, and then talk about some of the diagnosis and treatments. And I may hop around a little bit. Some of these slides might be very familiar to some of those that did some of our previous podcasts, but there will be some new material that I'm definitely going to share tonight. So let's just start off with just like a very basic overhaul of what are allergies. And the main part is being exposed to things that cause unnecessary inflammation. I'm going to apologize. My voice is going to be kind of in and out of here. I'm recovering from some plague that I got at work last week. But exposure and, the pretty flower, the pretty trees, the pretty grass, some of these other outdoor allergens. And it's usually a seasonal thing. Certain things have certain seasons that it will bug us. By having that exposure, your body makes a reaction, releases these things called histamines. That's probably the biggest inflammatory response that's responsible for allergies. And then, of course, some of these common symptoms here, the eyes, the runny nose, snot, lots of snot. Okay. It is a false alarm. This is not infection. This is your body's unnecessary response from a standpoint of what's going on. And the immune response is the thing that we try to mute because we can limit the exposure, but once we're exposed to it, we need to decrease the response. And what's happening for our allergic rhinitis, not our non-allergic rhinitis, and we'll get into that in a little bit, but from a standpoint of our allergic rhinitis, we've got little proteins in our body that say, Mayday, Mayday. We've got an alarm going off, and then that precipitates that chain reaction. So this is a nice cute little list, and there's actually 12 things here, not 10, but from a standpoint of the grasses, tree, lawn, dust mites, pet dander, mold, these are definitely the things that we'll see. But along the bottom are some of the other things that are a little more challenging from a standpoint of what are you exposed to. These aren't quite seasonal. These can be things that, when you're a patient, things to be very mindful of, because these are pieces of history. So that is when a doctor asks you questions and says, hey, can you, help me decide how to proceed forward with how to get your symptoms better. But perfumes, hand lotions. I mean, we all love Bed Bath and Body. Well, some of us like it better than others. But perfumes, cleaning chemicals. Lately, I've had a number of patients that had new construction and, putting in new flooring or new carpet, and it caused a big reaction, a lot of congestion, swelling. I had a few folks that had like some facial swelling. So, and that's an unnecessary reaction to an environmental trigger. So, but again, a harmless substance that causes an unwanted reaction. So this is probably one of the big things as a patient, because you're not going to show us the day that you come to see us, when am I having symptoms? Because you're not going to demonstrate to us. You're going to have to tell us what it is that you feel. So the immediate phase, and that's I was exposed to grass cuttings and I had itching, sneezing, watery eyes. Or, gosh, that earlier day I mowed the lawn, and that evening I started having congestion, swelling. My eyes got full, mucus dripping. I had a dry cough that kept me up all night. But, as a patient, taking good notes, and whether you write it down or keep it in mind or, those sorts of things, but it's really important because this is definitely the symptoms that we're looking for. We definitely want to know if that's an immediate or if it's a delayed onset. Does the onset that comes later, does it last all night? Does it just last short period of time? Is it for a day? Is it for a few days? But these are all the key parts because honestly, the details and the stories that you bring in as a patient is so critical for us to get to know what we need to treat and how to make you better. Unfortunately, it is usually a whole body system response. So it's not just the ENT world that we all know and adore in our practice, but from a standpoint of other things. And these are important details that, again, as an ENT, we're going to want to know about. We may not inspect every body part, but from a standpoint of knowing. So one of the things, wheezing, cough, chest tightness, and knowing, did you have a history of asthma as a kid or as an adult? Those kinds of things. Red, itchy, watery eyes. Some people just get the eyelids swelling. One eye, the other eye, one eyelid, the other eyelid. Rash, red skin, hives, scratchiness. I've got some patients that just get that sort of rash on just the arms. Sometimes it's on the body, sometimes it's on the cheeks. Depends on if it's, especially with like lotions and perfumes and dryer sheets. Oh my gosh, dryer sheets. And just taking a look to see where it is that you're having the itchy, and if you're having itching, is it with hives or is it with just sort of a red bumpy rash? Runny nose, stuffy nose, two very different things. Runny nose is usually the immediate symptom, and then the stuffy nose is usually, hours later, especially when you're trying to go to sleep at night. Fever is not very common. We'll sometimes see this more often in kids. Sore throat. Is it a swallowing sore throat? Is it drippy sore throat? Is it a cough sore throat? But, again, kind of looking for these things, swollen lips, eyes, tongue, face. We'll definitely see that much more often, the lips, the tongue, and airway swelling and anaphylaxis. And we'll get into that in a little bit. But headache, again, trying to decipher if it's a headache from a standpoint of sinus pressure. There can be a lot of overlap in that symptom. But again, trying to do the best you can to tell us what it is. Cough, productive or dry is probably the biggest factor with that. Stomach pain, vomiting, and diarrhea. So between the stomach issues and your swollen lips and tongue, those are two big symptoms that are really concerning. And I will tell you, if you start having those symptoms with any particular allergen, medication, you're calling 911 or you're getting a ride to an ER, an urgent care, because you do worry about this thing called anaphylaxis. And that is a really dangerous body reaction to a trigger. To belabor a little, other things that you might see as something that causes reactions, the airborne stuff in that far left corner. Skin, definitely like the chain. We'll see some like that rash around the neck. That's usually from nickel-based sensitivity. You'll see that in necklaces. Latex, a lot more with tape, masks. We saw a lot of that during COVID. Sometimes gloves, fragrances, cleaners, cosmetics. Females have to really be careful with what we put on our eyes and eyelashes because sometimes those things can cause bad reactions. Specific kinds of plants, especially if you go into some poison ivy. Food, which is a little different when it comes to reactions. It's usually more stomach related, and we won't see that as often in ENT, but something just to keep in mind that can be a type of allergy. And then of course medications and penicillin and sulfa, those sorts of things. And as you come to the ENT, these will be ones that we'll also review and make sure. Okay, the seasonal thing, let me just break it down. In Buffalo, we distinctly have 4 seasons, and all 4 have a tendency to be a little more robust. And the timing is always a little bit different from year to year. One thing that I remember from last year is this fall. Ragweed last year, we didn't have rain, and we literally had August, September, October, and almost half of November with some sort of fall weeds. Ragweed and goldenrod were a little more early fall, but we definitely saw fall allergies being a little more long in duration because we just didn't get rain. Over the winter, it really is mold and dust. Spring, the trees. This year, oak and maple were at the same time. That was pretty vicious for some of us. And then just recently is cottonwood, and cottonwood was bitter, sweet, very pretty, but the little flakes of cotton were everywhere. And of course, grass. And we're seeing that right now. And you'll notice that this year we had a lot of grass that was growing fast. So people were mowing their lawns and we weren't quite done with cottonwood. So again, overlap with what allergies, affect which people. Okay, sorry, let me get a little break. Okay, back to diagnosis. So as we talked about history, lots of questions, lots of details, lots of going over things and making sure that we understand what you're coming in with. So physical exam. So as an ENT, we have the benefit of really looking into the crevices. So as an ENT, I'm like an allergist, a pulmonologist, a dermatologist. We can look inside the nose and we can tell a lot of what's going on in the nose, especially when you guys are coming in with active symptoms. Doc, I'm stuffy, or my nose is dripping, or I can't smell. Those are things that as an ENT, we can evaluate in great detail. When we numb the nose, when we so you'll come in, right? You'll see us, we'll ask you all the questions, and then it's taking a look. We'll take a look in the nose, the ears, the mouth, those sorts of things. And then depending on what we see and what your history dictates, we may need to do a procedure. These two words, nasal endoscopy, it is the way that we describe almost like a telescopic exam. So we'll numb up the nose with a decongestant and Ponticaine. That kind of just opens things up. You're less stuffy. And we can stick a small probe. It's about the width of a spaghetti noodle, has a camera on the end of it or a light on the end of it, and we can take a really good look. Sometimes, excuse me, we'll take a look in there and we'll have the ability to take pictures and we can show you. And other times we can't quite do the scope with the pictures and won't be able to directly show you, but we can describe to you, right? We can use medical illustrations to tell you this is what we're seeing. From a standpoint of other things that we can see in the nose, we're not just looking for allergies. We're looking for other things like infection and a deviated septum and polyps and congestion and adenoids and, a lot of structures, but also sources of inflammation that may be causing your symptoms. Okay. Appropriate testing. So we as Western New York ENT will be doing allergy testing. So you're not going to just come in and get the good old WENT look. We're also going to start screening and starting to do allergy testing. And allergy testing can be really, really helpful for diagnosis. It may or may not make a huge change with treatment depending on test results and all, but it'll give you more answers of, okay, what is going on with me? Why am I miserable? Why am I suffering? From a standpoint of allergy testing, there are two ways of doing it. This easy and simple way of blood testing, which unfortunately is not as precise as what we call skin prick testing. And what this does is it takes specific allergens, depending on what your story is, depending on when your symptoms are, how bad they are, and consider doing prick testing. And so we literally take a little sample of the allergen, so the irritating, and we put it onto the surface of the skin. And it's called a scratch test because it literally scratches the surface. It's not a needle, it's like a little prick. And we will take a look to see, does your body make a swell reaction? Does it bring redness? Does it look? And it will give us specific details about, is this it? Is this my trigger? All right, so a nice little slide summary of the things that we've already talked about. A few things that I do want to stress that when you, as a patient, come in for evaluation, bring in the list, bring in everything you've tried. Has it been Sudafed? Has it been over-the-counter Advil, sinus, and cold? Has it been decongestant sprays? Has it been, herbal remedies? A few things that I've been starting to see, people are using some of these products that are non-medication. So eucalyptus oil, aloe sprays, trying to think off the top of my head, some of the other things that I've seen. One of the things I saw was like a bronchial syrup. And it was just a mix of different homeopathic things put together. Some of it has echinacea in it and those sorts of things. And if you can't bring in the whole bag of stuff, well, then take photos. Bring in what it is that you have used, things that you have failed. Like, I've tried this, it didn't work, so that we know, sort of what things you've tried, how desperate things have been, and from a standpoint of just knowing what you've done. Alleviating exacerbating factors. Some patients will use cold compresses, steam, Vicks Vapor Rub, some of the other things that I'll see, essential oil diffusers, those sorts of things. Past medical history, a few things that we'll definitely ask. Have you had ear tubes as a kid? Did you have lots of respiratory infections as a kid? Were you diagnosed with food allergies as a child, reflux as a kid? Asthma, exercise-induced asthma, teenage, like, again, we're going to start asking questions. We all are going to ask, have you had pets? When you've had pets, have you had symptoms? From a standpoint of, this isn't directly pertaining but alcohol use, but tobacco. Did you smoke cigarettes? It's amazing to me over the years of patients who were smokers, quit smoking. No doubt their health improved, and yet their mucus in their nose got worse. And there are reasons, but don't go back to smoking, right? So again, things that we're going to ask. Okay. So I think this illustration right here tells you sort of how important things are from a standpoint of getting the story, but also taking a look, examining, and testing. So, just kind of reading through all this, testing has limits, pulmonary function testing, taking a look at lung function, those sorts of things. But there's the testing tells us what the immune system could react to. History tells us what actually happened. So you and your body have a story. We'd like to know it. And then together, we put all of this together. Family history. I do want to go over this just a little bit. Sometimes it's nice before you come in to ask a parent, ask a sibling, ask, family that has been sort of through it with you. Sometimes the spouse, sometimes our spouses know us better than we know ourselves. And from a standpoint of, and not that your spouse's past medical history is a direct combination, but if the two of you share the same dog allergies, the same seasonal allergies, sometimes, that can help sort of elaborate what's going on. But there is a family history that can be passed along with allergies. You can see that with asthma. You can see that with eczema. You can see that with food allergies. The angioedema and urticaria, it's not quite as consistent. It depends on what's causing the angioedema and urticaria. But, significant food allergies as a kid, if you had a sibling that was, heavily asthmatic and in the ER every spring, just sort of knowing some of those details, because it sometimes will give us just a little hint at what goes on with you. All right, let's look at allergies. Love these pictures. They're all pretty miserable people, unfortunately. All right, we'll start with the bottom right-hand corner, the ear. The eardrum. This is a picture of an eardrum that's retracted and is pretty unhappy. It's not an infection. This is a result of eustachian tube dysfunction. And I would say that a lot of patients had some of this spring. A lot of congestion, ears feeling plugged. I can't hear, it's muffled, or my ears had a reluctancy to pop. I tried to pop my ears. It didn't work, or it worked, but it was temporary. But this is one of the things that we'll be looking for on an ear exam is how do your ears feel? What do they look like? Denny's lines. I'll see these more often in kids, but you'll see these cute little lines right underneath the eyelids. And those are definitely due to chronic allergy symptoms. The under the eyelid redness and irritation. Obviously, her eye is also bloodshot, but this is definitely a telling sign of the eyes are itchy, scratchy. It feels like they're sandpaper. Eye drops, regular over-the-counter saline drops can definitely be very helpful for that. But those eyes are definitely looking like something that would happen within an early onset of allergy reaction. Allergy shiners. I'm trying to point out these dark blue circles. These are pretty subtle compared to some that I've seen this year with tree and grass allergies. These can come and go, usually in the kids that are outside in the trees or outside a lot and during the tree allergies, and we are suspicious that they have tree allergies. So these will be pretty dark and violet, almost purple. And then back of the throat. So I would say this is a pretty hard find from a standpoint of looking at your own throat. I'm not sure how many times you guys have taken little smartphones or a flashlight and looked back there and see what you can see. You can usually see your tonsils. You can see stones and crypts in the tonsils, but very back of the throat. The back of the throat is supposed to be a linoleum floor. This is not. You'll see this something called cobblestoning, and this can be a sign of allergies. It can usually be associated with some really thick postnasal drip, but this is usually associated with the my throat's scratchy, doesn't feel very good. Things that I didn't have on this slide, nasal exam, there are some really telling signs, like the inside of the nose being pale or almost blue, like a venous congested look. Symptoms of the voice, probably the best would be the scratchy, sometimes clearing of the voice sounding kind of wet. It's not the only way that allergies present themselves with the voice, and there are many other problems, one of them being reflux, others being other muscular issues that can cause voice symptoms. But again, one of those things that we'll ask, let's see, what else did it say? I think it said skin and rash and those sorts of things. Okay. And there's one more down there, but I'm not sure what it is. All right, so skin prick testing. From a standpoint of skin prick testing, this is probably the best way to test to see if you truly have allergies, because the blood testing below does not always pick up on everything. Blood tests is pretty simple. You go to the lab, they grab typically 1 or 2 test tubes of blood, they send it off to the lab and they check. And they're looking for these things called IgE proteins. And they're looking to see if they are specific. And we typically, when we send patients for blood work, we're looking for the seasonal, so trees, grass, pollen, ragweed, fall mold, those sorts of things. There are perennial, which are more dust, dog, pet dander. I'm blanking on the other one, dust mites, dust, but there are a few others, and those are more like the year round, like there isn't a seasonal flare up to those. And so again, your history and what you complain about will be a big determinant of that. It's easy. You just go to the lab. Test results for about a week. Depends on your insurance, how expensive they are. A lot of our high deductibles, everything's expensive until you've met the threshold. So, necessarily cost being the only factor. And if you can't go through skin testing, we'll go through that in a second, but again, this is an option. All right, so skin prick testing. So the nice thing about it is we can do it on things like the forearms, right? Like right here, side of the arms, and then sometimes the back. Super duper sensitive. So this means that if you have a reaction and the test runs like it's supposed to, that there is a very accurate way of saying, yep, you are allergic. And we can use this data to do slightly more detailed testing to see how allergic you are as well. Mild itching and redness is a little bit of an irritation there, depending on how bad your reaction is. I've got some patients who just need an allergy pill, others that need Benadryl. Every once in a while, people turn into a little volcanic explosion of fire. And sometimes they do need some like lotions, topical steroid creams, and those sorts of things. The big thing with skin prick testing is that there are some specific medications that you have to stop before having skin testing. So getting off the allergy pill. You have to be off certain nasal sprays, not a nasal steroid spray, but other types of nasal antihistamine sprays. And then there are some other medications that you can't be on. One particular is like something called a beta blocker. Some people are on it for anxiety, others are on migraines for it, and others are on it for blood pressure management. So there are some things that it can't be done with. Briefly, we'll go over this. In the ENT world, we don't do pulmonary function testings. I don't know if all allergists do or do not do it in your office setting. It is an extension of the airway. So we all know that we breathe in through the nose, if it works, in through the airway down to the lungs. And the lungs can have their own problems and challenges. And asthma is one of the many diagnoses that we will see. It is with certain criteria. You have to have certain symptoms, duration of symptoms, and you're typically put on different medications for it. With pulmonary function testing, depending on what your symptoms are, especially if we are suspicious of allergies with things like possible asthma, pulmonary function testing can be very helpful. Pulmonary function testing will check for, how much air you're inhaling and exhaling, how quickly you can get the air in and out, especially on the way out. And then there are some ways, there are some ways that your body and lungs can respond. So depending on what kind of pulmonary function testing, they will sometimes give you an irritant to aggravate the airway to see how your body responds to it. So pulmonary function testing is a very specific test and very, very helpful. And down here, it'll a little bit of, it detects asthma, can help determine if there is, the wheezing, the cough, those sorts of things. And there are reactive airway disease, some people that have COPD. And sometimes it's something that's completely not related to allergy itself. So pulmonary function testing can be very, very helpful. All right. Management. So let me just take a look. Yeah. So say we find out, okay, you're allergic to dust and it's mild. Okay, so dust is kind of year round, much more for our 5 to 6 months of winter. And we'll know that, okay, dust is your problem. That is the thing that bothers you the most. What can we do about it? First and foremost are the easy allergy pills. So Claritin, loratadine, fexofenadine, which is Allegra. We now have Zizol, which is levocetirizine, and that is over the counter. And there are those are what we consider non-sedating. So they shouldn't make you too drowsy. You should be able to get through your day at work. You should be able to drive. Not everyone, but I would say the majority of people. And then there's sedating ones, Benadryl and hydroxyzine. Super, very potent allergy medications, but can be very, very sedating, can make people drowsy. I do have patients that build a tolerance to the drowsiness like hydroxyzine, and they do pretty well with it. The nasal steroid sprays. So we've now transitioned to over-the-counter nasal steroid sprays, and there's some really good ones. The ones that we typically still get good coverage on is fluticasone, which is Flonase. And there are some nice ones that are over the counter that insurance unfortunately won't cover. I always think of Nasonex and mometasone, which is a nice one because it's not stinky. It doesn't have a smell to it, and it's not as drying. Budesonide, which is Rhinocort, it's a really good one as well. There's Nasocort. I would say that, if you're the occasional user, if it's on sale, try it. The thing is with nasal steroid sprays is that you have to be careful on how you apply it. So nasal steroid sprays, just to demonstrate. So if this is your spray, what's going to happen is you're going to go into the nose, into the nostril, and you point it away from your septum. So your septum is the wall in the middle of the nose. So what you want to do is go in and point outwards. Now, you can tip it a little bit down or you can tip it a little bit up. And everyone's anatomy can be a little bit different when it comes to the nostrils. But you don't want to just go straight in because that's not the surface that needs the medication. It's the stuff sort of more on the outside. So in, pointing it towards the ear, in, pointing towards the ear. There are some prescription fancier ones. I've got a few patients that are on some fancier ones like Xhance and those sorts of things, and we can get into that a little bit. Eye drops. So we have the luxury of moisturizing eye drops. We have the easy, cheap ones that are there just to kind of rinse the eyes out and moisturize. They've got ones that have get the red out, which can be sometimes helpful for the patients that have really red, irritated eyes. They even have eye drops over the counter called Pat-a-Day, and that has been a big improvement. They're not the cheap ones. Compare when you do the moisturizing drops to the Pat-a-Day, but Pat-a-Day is really helpful for the allergy eyes, and it doesn't burn. Definitely helps. It can be twice a day, but from a standpoint of eye irritation, weepy eyes, sort of a film over the eyes, my patients with dry eyes and have allergy symptoms in the eyes, it's just brutal. So the Pat-a-Day has been a very nice product to have access to over the counter. Inhalers, the good old albuterol. I do think that there's an over-the-counter albuterol now, and I haven't readily seen it in any of the pharmacies locally, but I definitely have seen a few of those. And, for the sort of the bad, once in a while coughing, wheezing, if you think it's associated with allergies, maybe a good option. I would always talk to my primary care if you feel like you have times of the year that are wheezing, or come to see us. But from a standpoint of bringing up wheezing, there are some non-steroid inhalers that can really help with some of those symptoms. Alternative homeopathic options, I think, let me just skip ahead real quick. Okay. The cold and flu aisle, I will tell you that every time I go into it, it seems to be just a little bit more overwhelming. And it used to be the cute little homeopathic ones, and these are like non-medication options. We're used to always be on just the bottom shelf. Like all the good stuff was up high and you just looked low. And I would tell folks, all right, you're looking for this product, go to the bottom shelf. Well, now they've sort of intermixed all of them. And saline spray is probably the biggest, easiest thing to do in the nose. There's no side effects. It doesn't burn. It doesn't hurt anything. But all it does is really moisturize. And sometimes moisturizing is good. There are other ones. And let me get the hypertonic. I thought I had a bottle at my bedside. I must have put it away. So hypertonic saline spray. And you'll see this. I've actually seen this more now at Target and Walmart and Walgreens and all of those. So I'm going to try to show this one right here. So you're going to see that it says hypertonic or extra strength saline spray. And what this is, it's a product that has extra saltiness to it. And because of its formulation, it helps to decongest without being a decongestant. And I'll go into that in a minute, but sort of wicking some of that sponginess out, that really wholehearted, like at the end of the day, I had a little allergy symptoms and now I lay down and I can't breathe at night. Hypertonic or extra strength saline spray can be really helpful for that. And you don't have to worry about rebound congestion. So we all know Afrin. It's also sold as oxymetazoline, neosynephrine, and again, alternative therapies. But if you read the really fine print, and I feel like the font has gotten smaller and smaller, that if you use these decongestant sprays, especially the ones that have the decongestant with the menthol, and you do it for more than 3 days in a row, you're going to get rebound congestion. And I do, every once in a while, I see these patients where it's like, I didn't know. I had nothing else that I could use that would give me the result. And they become addicted to it. And they start having rebound congestion where the congestion is actually worse than it was before they started the decongestant spray. So things to be, sort of cautious about, especially the patients that like rub Vicks vapor rub in the nose every night. That's also one of those no-nos because it can cause rebound congestion. There's another spray that's called Xlear, Lear, can be really helpful for sweeping some of the mucus out of the nose. Immunotherapy, we'll get into the shots here in just a minute. Those are allergy shots. There are other things called sublingual tablets and sublingual drops. And then I don't want to not include this in our, sort of treatment methods, but in an emergency, patients who have anaphylaxis, patients who have an asthma attack, starting to struggle to breathe, that EpiPen, right? The epinephrine auto-injector, the EpiPen. And it is a really effective way at treating a bad allergy attack. Okay, so let's go back to the shots. I'm going to go back to here to the skin prick testing. So allergy shots is sort of an extension of what skin prick testing is. And after skin prick testing, knowing, okay, so say you're allergic to grass and grass is your thing and the grass is really bad. And doc, I've done the pills, I've done the sprays, and every year the grass allergies get worse. And I really feel bad for my landscapers because that's their job, or my farmers, that's their job, and they're out in it all the day. So from a standpoint, what are the options? So we've come up with immunotherapy, which is we're treating our body to say, I've got allergies. Let's tell the body to stop making such a bad reaction. So when we look at the system, we are telling the body, all right, we're going to take the antibodies and we're going to start treating those so that you no longer have these flaring up. We're going to tell the immune response that this part of it will stop so that when we have exposure, we don't release the histamines. And what happens is if we do allergy shots, we're giving your body little pieces of that trigger sequence. So we start with the lowest safe dose, and then we increase slowly to the point over a period of 1 to 3 years to get your body to say, okay, I'm no longer going to have a bad reaction to it. Allergy shots is time consuming. It is a titration. So we typically do allergy shots weekly. until you graduate to monthly. And then typically monthly shots are about 3 years in duration. And it is time consuming. The shots are given in an office setting because there is a concern that you may have a bad reaction and you want to have available medical attention immediately. So this is sort of a time intensive process. Sublingual tablets. So Europe has been doing this for years and years and years. And it finally came to the States about 6, 7 years ago. It's called Grass Tech. And it is a tablet. It kind of looks like an allergy tablet, but you stick it underneath the tongue, floor of the mouth, and you dissolve it. And it's an everyday thing. You start a few months before the grass season and you let it dissolve underneath the tongue. And it's an everyday thing. The first dose is when you're in the office. So we make sure that you tolerate it okay. There's no floor of mouth swelling. There's no itching. But from a standpoint of once the first dose goes fine, we watch you, everything's okay. And we also train you because if you have a bad reaction, you're going to give yourself an EpiPen shot. So those are all parts of like the patient education, but you can do Grass Tech at home. It's a pill. You stick it underneath your mouth every day. Once you're done with the first year, you're expected to do it for 3 consecutive years. And it's like allergy shots without having to come to the office. And we have it available for grass. We now have it FDA approved for ragweed called Ragatec. And then there's one for dust mites called Odactra. And Odactra is given a little different because it's every day for 3 years. So there you go. A type of allergy shot that doesn't have to go to the allergist or to the doctor's office for an allergy shot. The last one is something called sublingual, which is drops. And it's been used in Europe for a long time. It is designed per individual. It is a compound where the treating provider will find out what you're allergic to, choose what allergens they will put into the drops. And then it comes in a little bottle. It's got a little stop, like a pump bottle, and you stick the drops underneath your tongue. And it's an everyday thing for up to 3 years. And from a standpoint of it's not FDA approved, but it is effective and it has been used in Europe. For the busy professional, it can be a game changer because you may not have time to do allergy shots. You may travel too much. You may have other outstanding issues that prevent you from doing it. The problem is cost, and every allergen has a different cost to it. So apparently right now, cat is one of the more expensive sublingual therapies out there. But if it's dust isn't as bad, so from a standpoint of cost effectiveness, and your testing provider will go over, all right, so, this is your situation. This is what I think you should do, and sort of moving forward with that. Okay. So that's a little bit about treatment. Okay. Without treatment. So let's do that. Long-term poor allergy management can result in a lot of quality of life issues. And some of these things are in some ways more adult related and some are more kid related. And it also depends on the duration and the severity of your symptoms. We probably all are familiar with the daytime fatigue and drowsiness during bad allergy season. It's like one of those things like, am I getting sick or am I just tired? And you will see this a lot with the pollen count. So I personally have an app on my phone during the tree and ragweed. I'm kind of checking it on a daily basis. It doesn't always seem to be completely accurate to what my symptoms are, but it gives me a good rough idea, like, okay, are we dealing with it? And you'll notice that you'll feel just a little bit tired, a little bit more dry. Dental issues. The dry mouth can sometimes be just more irritation of the voice, not necessarily just a dry mouth. Sometimes the dry mouth is secondary to the nasal congestion. If your nose is really stuffy and you spend a whole night mouth breathing, your mouth is going to be dry. With kids, it can cause cavities. And a lot of the problem with children is that when they have bad allergies and a part of their immune system or part of their processing immune system called adenoids and tonsils can be a part of that. So again, taking a look at your child, taking a look at symptoms, taking a look at what things you've done bringing it up with a pediatrician, and then, sort of looking at how is my kid's health. My dentist have talked about, having lots of cavities, dry mouth, those sorts of things, and putting things together. Sinus infections. Oh, this is a big one. This is probably one of the big factors I saw last fall because ragweed season was pretty bad, didn't have much rain. And we started having viral infections probably November, early December. And I had a lot of patients like, Doc, I thought it was just allergies. And then we got into the viral infections and I got really sick this past year. And some of the viruses were kind of nasty, but we'll see that as a factor of if you have unnecessary congestion, thicker mucus, you're feeling more run down, you may be more susceptible to viral infections turning into bacterial sinus infections. Asthma flare-ups, allergies and asthma, the two are just symbiotic. And if the allergies are worse, your asthma is worse. If your asthma is worse, your allergy symptoms can be worse. So the two can feed off of each other. And the pulmonologist will tell you it's really important that we keep the airway as controlled and managed as possible. Ear infections, I'll see that more with the kids again because of the stuffiness of the nose, adenoids, and their smaller nasal cavities. Have seen some adult patients, though, that this can be an extension. It's usually an extension of eustachian tube dysfunction leading to ear infections. School and work struggles. One of the big research topics that we'll see is how quality of life is affected by things like chronic allergies, chronic nasal congestion, sleep problems, snoring. So we will see how that definitely has direct correlation with what's going on in our immune systems. If it's not allergy. Okay. So just to kind of give you why do you go see the doctor for some of these things? And sometimes because it's not the easiest, most straightforward answer. And if your history, say you come in with all these symptoms and you thought it was allergy, come in and we start looking at things and we're like, wait a minute, this doesn't look like, or just look like just allergies, because there are so many other things that could go into this. So infection, right? That's one of the reasons going to see an ENT and having a full evaluation can be really helpful. We'll make sure there is or is not infection. Chemical rhinitis, it's not truly allergies, but it can be a sensitivity. I definitely have seen a fair amount of this in some of my hairdressers, patients that have to deal with a lot of chemicals. Gustatory rhinitis, vasomotor rhinitis. Oh, the drip, the drip, the drip, the drip. And sometimes it's not just allergies. And then rhinitis medicamentosa. This is the description of what Afrin and overuse of decongestant sprays can do. This is that rebound congestion. And it can be a really difficult problem to manage without medical intervention. Idiopathic rhinitis. Oh, the patients that have all the symptoms of allergic rhinitis. We do the full workup, skin testing, blood work, this, that, and the other. And then it's you have non-allergic rhinitis. Doesn't mean that you don't have options, but that it's not you just need an allergy pill. Oh, you just need allergy medications. You need allergy shots. And again, the way to get to this is process of elimination. And that can sometimes be a little bit of, sort of a testing and sort of a thorough workup. And then you come to the end of the rope going, okay, it's not any of those things. It's idiopathic. Hormonal, we'll sometimes see this, especially in pregnancy. Your nose goes through a fair amount of changes, and sometimes those changes go back to normal after pregnancy, and sometimes they don't. We'll sometimes see changes with patients who've had chemo therapy. Certain medications can be more aggravating than others. We'll sometimes see this with menopause. It's not quite as often in the nose, but I have had patients where their previously diagnosed allergies change, and after menopause, it's a different problem. So, that kind of thing. And then, of course, the last but not least is unfavorable anatomy, like we talked about, going in there, taking a look, what's going on, kind of thing. So, so at the bottom, this is sort of like a really good summary of, why see an ENT as opposed to just my primary or just an allergist. And I wouldn't say that we do more than the allergist, because we don't. We have a different perspective. We have a different evaluation from a standpoint of different thresholds. I share patients with allergists. I have patients that share their patients with me. So it never hurts to start with one or the other. I would say my patients that probably have the biggest high yield from coming to see me are the ones that I've tried the pills, I've tried the sprays, they didn't help. One side is always blocked. I'm having nosebleeds. Those things to me, or I've had 4 infections this past year, I'd start with an ENT from a standpoint of what we can do and how we can evaluate, or at least start the evaluation process. But we treat the whole spectrum, and you'll notice that when you see me, it's a full history. There's a lot of questions. There's a lot of details, because it's important. It's important to get to the bottom and get you feeling better. So, yeah, I'll leave that up as key takeaways, but I would be happy to entertain questions, review anything, and Mark, I'll turn it back over to you.
Great. Well, thank you very much, Dr. Stawchiw. Particularly chock full of information, even though you're not necessarily at 100% health wise yourself. So we appreciate that. But yeah, if anyone does have any specific questions, as I mentioned at the beginning, you can certainly use the chat function to type that in, and we'll get those in front of Dr. Stawchiw right away, and she can answer them for you. But I'm not seeing any come in yet, and that may well be a reflection of how thorough your presentation.
I put my audience to sleep.
No, not at all. Here's one from Renee. At what age can allergies start?
That's a really good question. I don't think that there is a hard start date. There is a pretty hard start date when it comes to testing. And most of us, from a standpoint of the literature, will say allergy out, like from a standpoint of environmental allergies, is typically testing is not started between 4 to 6, depending on symptoms, depending on airway symptoms, asthma. I typically have not seen patients get skin testing before age 5 or 6. Food allergies, slightly different. I have seen patients that will have blood work done. Sometimes when I have kids who need ear tubes and I'm working with their pediatrician, their allergist, they will request blood work. I typically don't feel qualified to sort of preemptively start those things as an ENT, but always happy to help. From a standpoint, it just seems like the kids just don't present with enough either symptoms or skin reaction or blood work results to be really definitive. But I have had allergists who are like, just test them anyway. Let's just get a start with maybe what is or is not going on. And family history can also be a big part of how to determine when to start looking for those things. It's a good question.
Here's another from Neil. Any insight on treating the GI symptoms during an allergic flare?
Yeah, really good question, and thank you for bringing that up. And I should have touched on that. We could spend hours talking about all this stuff. One thing that I have sort of been surprised at is some of the cross reactivity of some things. Let me start with sort of like one of those cute little light bulb moments, like ragweed. Ragweed is a really potent allergen. A lot of us are allergic to ragweed to some degree, and some of us who are really allergic to it will also have GI symptoms. It just seems like the acid or a sour stomach or just a little more sensitive during that time of year. And there's a cross reactivity between melons, especially cantaloupe and honeydew, kind of watermelons, not so much, but patients who eat like cantaloupe or honeydew during ragweed season, it seems like it is really tough on the GI tract. From a standpoint of symptom management, Tums is fine. For I'm having reflux, I'm having indigestion, taking the Tums because it really does seem to mute that fire. There is definitely a component of some reflux medications, in particular, something called famotidine or generic Pepcid. And it's what we call an H2 blocker. That's a histamine blocker. And so patients who have really bad allergies along with queasy stomach or reflux symptoms, I'll tell them, well, when you take your allergy medicine, like your loratadine or your allergy pill at night, go ahead and take 10 or 20 milligrams of famotidine on those nights as well. Ragweed season, I'm a proponent of, the days that you're outside, take an allergy pill every day, and then also take a Pepcid or famotidine at night, just to at least calm as much of the inflammation in the body as possible. But yeah, that indigestion feeling that you'll sometimes have with bad allergies is a real thing.
Here's one from Richard. Is there a relationship between allergies and snoring?
Yes. So there is. And what we understand allergies to cause, at least in the nasal part, is a vicious congestion. That second, I'm just going to pull up the slide because it's that secondary, it's that delayed phase. So at the end of the day, right, you've got grass allergies. You kind of got through the sneezy, watery eyes thing. You're about to go to sleep at night. You're like, wow, my nose is so stuffy. And there are structures in the nose, in particular these things called turbinates, that get really swollen. And it's part of the nose that is important because it humidifies and moisturizes the air. But when it gets swollen, it blocks you up and it can be really tough to breathe around. So, and if it happens when you're going to sleep, you'll find like, oh my gosh, where's my sprays? What can I do? I'm going to raise the head up a little bit, raising the head of the bed just so that you sleep a little more elevated. But no doubt that that will contribute to more mouth breathing, which typically coincides with snoring. There are some other things. Some patients will notice that their mucus is a little thicker. They can't, from a standpoint, they just don't feel like they're getting enough air through the nose. So maybe they're not as congested, but their secretions are a little thicker and they'll snore. And then some patients who don't feel anything, but they're just more mouth breathing. But we'll also see more snoring with reflux. We'll see snoring with, uh, from a standpoint of just viral infections. And then, of course, alcohol use. So that's probably a big one for people to understand is that allergies, mild allergies with a little unit of alcohol or two, especially within a few hours of going to bed, can really aggravate snoring. So.
Here's one from Carol. I use CPAP every night.
Mm-hmm.
Can I use a nasal spray before bedtime?
Yes. So CPAP, wonderful tool, non-surgical, and it has definitely been in research proven to improve sleep quality. It's really hard to tolerate your CPAP if you're having bad allergies or having a lot of congestion. If you're having congestion, the hypertonic, and I'll show you a little picture of that again. So the green, right? This one right here is safe to use. And I would recommend doing it about half an hour before going to sleep. And what it will do is it's just going to reduce some of the bogginess and it might get rid of some of the thicker secretions that might be adherently stuck in the nose. You don't want to use the spray and immediately apply your CPAP because you might start moving some of the sludge that's been sitting in the nose. So for me personally, I will use this spray about an hour before going to sleep. I typically will also use nasal irrigation if I'm out and there's a lot of pollen and other kinds of things before going to sleep. You can use nasal steroid spray products, Flonase, fluticasone. It's all safe to use, but I usually tell folks try to use it at least 15 minutes before going to sleep. You want things to kind of sit in the nose where they're supposed to before you start blowing it past the structures that you are trying to treat. But yes, it is safe to use with CPAP.
Right. So I'm not seeing any other questions. When we do a last call for questions, it's just about 7:30, so this has been super efficient. Oh, here's one. My nose is dripping all the time, and sometimes when I eat, my nose will start dripping.
So we're going to go to, if it's not allergy, what is it? Vasomotor rhinitis. So just to give a quick, because the nose is a very fancy creature, and you as a human being cannot see it. And so you are going by symptoms, right? And the ones that are very drippy, especially with mealtime, the other two triggers are air conditioning and sometimes the heat. So my favorite one for the winter is I am outside and then I go inside to a store and my nose just starts dripping like a faucet. So there are some over-the-counter products that are considered what we call nasal antihistamine sprays because an allergy pill is not going to turn off that drip. And Astepro, Astepro, Astepro can be really helpful for that. And it won't dry you out. It just tells the inside of the nose, stop dripping. And you can use Astepro as needed. A lot of my patients who use these over-the-counter nasal antihistamine sprays will say, it doesn't really bother me, but when I go out to eat with the girlfriends, when I am going to a wedding and I don't want to drip during the meal, a nasal antihistamine spray can be really, really helpful.
Great. Okay. anything else from anyone? Any other questions? So it's just about 7:30, but if there are any other last minute ones, we can squeeze them in. If not, then we will say a couple things. We'll say thank you to Dr. Stawchiw for the great presentation. And thanks to everybody who joined us and spent an hour of their pre-summer pre-summer evening here with us. And as I mentioned, this has been recorded, so we will send a copy or link to the recording to everybody who attended and everyone who registered. So if you want to see Dr. Stawchiw or anyone else at the team at Western New York ENT, you can do that at any time. Just give a call, 716-675-5711. Or if you're just looking for more information, want to do a little research, you can go to the WNYENT website. And you can also make an appointment through the website if you decide to do that as an alternative to picking up the phone. So yeah, I think we are good. I'm not seeing any other questions, so why don't we wrap? Thanks again to everyone. Thanks to Dr. Stawchiw. And keep your eyes open. We'll have more of these seminars scheduled between now and the end of the year. There's a couple more coming up. And the best place to check would be the website. And as somebody who's attended this session, we'll keep you informed via email as well. So thanks to all. Have a great night and enjoy the pending summer. And hopefully you can be allergy free during what will be the nicest time of year to be in Western New York. So good night, all. Take care.